PTCB PTCE Pharmacy Technician Exam High Alert Medications. 25 Essential Questions. Question 1. Which of the following is a high alert medication according to ISMP? Amoxicillin, insulin, loratadine, hydrochlorothiazide. Insulin is a high alert medication because it has a high risk of causing significant patient harm when used in error. Question 2. What is the standard concentration of heparin used for line flushes to prevent errors with therapeutic doses? 10,000 units/ml, 1,000 units/ml, 100 units/ml, 5,000 units/ml. Low concentrations like 10 or 100 units/ml are used for flushes to avoid accidental systemic anticoagulation. Question 3. Which medication requires frequent monitoring of the INR? Aspirin, warfarin, clopidogrel, heparin. Warfarin, Coumadin, is an oral anticoagulant that requires INR monitoring to ensure the dose is therapeutic and safe. Question 4. What is the antidote for a heparin overdose? Vitamin K, protamine sulfate, naloxone, flumazenol. Protamine sulfate is used to reverse the effects of heparin. Question 5. Which electrolyte, if injected undiluted, for push, can cause instant cardiac arrest? Sodium chloride, potassium chloride, calcium gluconate, magnesium sulfate. Potassium chloride must always be diluted and given as a slow-4 infusion. For push KCl is lethal. Question 6. Which type of insulin should never be mixed with other insulins in the same syringe? Regular, NPH, Glargine, Lantus, Lispro. Long-acting insulins like Glargine, Lantus, and Detemir, Levemir, have a low pH and should not be mixed with other insulins. Question 7. What is a narrow therapeutic index (NTI) drug? A drug that is very cheap. A drug where small differences in dose can lead to serious therapeutic failures or adverse reactions. A drug that is only given to children. A drug that has no side effects. NTI drugs, like digoxin or warfarin, require precise dosing and monitoring because the margin between a safe dose and a toxic dose is small. Question 8. Which medication is a high-alert neuromuscular blocking agent? Succinylcholine, diazepam, morphine, ibuprofen. Neuromuscular blockers cause paralysis and respiratory arrest. They are extremely high-alert medications. Question 9. According to ISMP, which of the following is an error-prone abbreviation that should not be used? mg/ml, U, 4 units, tabs. U can be misread as a 0 or 4, leading to a 10-fold overdose. Units should always be written out. Question 10. What is the reversal agent for opioids, like morphine or fentanyl? Vitamin K, naloxone, Narcan, activated charcoal, atropine. Naloxone is an opioid antagonist used to reverse respiratory depression caused by opioids. Question 11. Why is methotrexate considered a high-alert medication when used for non-cancer conditions, like psoriasis? It is very expensive. It is usually taken once a week, but errors often involve taking it daily, leading to toxicity. It causes immediate hair loss. It tastes bad. Fatal errors have occurred when methotrexate was accidentally taken daily instead of weekly for conditions like rheumatoid arthritis or psoriasis. Question 12. Which of the following is a major risk associated with intravenous potassium chloride? Liver failure, phlebitis and cardiac arrhythmias, hair loss, increased appetite. For potassium is irritating to veins, phlebitis, and can cause fatal heart rhythms if given too fast. Question 13. Which of the following is an oral anticoagulant that does not require routine INR monitoring? Warfarin, rivaroxaban, Xarelto, heparin, enoxaparin. Direct oral anticoagulants, DOACs, like rivaroxaban and apizaban do not require routine blood monitoring like warfarin does. Question 14. What is tallman lettering used for? To make the label look fancy. To distinguish between lookalike/soundalike medications. To indicate the drug is for adults only. To save space on the label. Tallman lettering highlights the differences in similar names. Example, diobutamine versus dopamine. Question 15. Which medication is an 4 sedative that is high alert due to the risk of respiratory depression? Propofol, acetaminophen, metformin, omeprazole. Propofol is a potent sedative used in anesthesia and ICU settings. It requires careful monitoring of respiration. Question 16. When preparing a high-alert medication like a chemotherapy agent, what is the best practice for safety? Work as fast as possible. Independent double-check by another qualified professional. Assuming the computer is always right. Doing it in a busy area to stay alert. Independent double-checks are a key strategy to prevent errors with high-alert medications. Question 17. Which of the following is a high-alert drug used for heart failure? Digoxin, vitamin C, penicillin, simvastatin. Digoxin is an NTI drug and a high-alert medication because toxicity can occur easily. Question 18. Which organization creates the list of high-alert medications? FDA, ISMP, Institute for Safe Medication Practices, FBI, CIA. ISMP is the leading organization dedicated to medication error prevention and maintaining the high-alert list. Question 19. What is the primary danger of magnesium sulfate injection? Weight gain, respiratory depression and heart block, dry skin, insomnia. Magnesium toxicity can lead to loss of deep tendon reflexes, respiratory arrest, and cardiac issues. Question 20. Why is oxytocin, Pitocin, high alert? It is used to induce labor and can cause uterine rupture if overdosed. It causes high fever. It is a controlled substance. It is only given orally. Oxytocin is used to stimulate uterine contractions. Improper dosing can cause overly strong contractions and harm the mother or baby.